Good evening. Tonight I'd like to tell you the story of one of my friends. Recently her mother spent about 2 weeks in the hospital. Her mother is her father's at-home caregiver. And so during this time, my friend was responsible for her mother in the hospital and also for her father at home. Well, when her mother arrived at the hospital, they told her that she would be seeing a specialist in about 3 days. And my friend wanted to be there for the appointment, to go with her mother. And the day before the appointment, they still hadn't told her what time it was going to be. So she asked the nurses at the hospital, and they didn't know. They said, maybe go down to the outpatient clinic. So she went to the outpatient clinic, and they didn't know anything about this appointment. So they called over to the doctor's office, the people that had told them they were making the appointment. There was no appointment. She ended up calling the specialist herself and making the arrangements of the appointment. So my point to you is that she had to be her mother's advocate. And this week she took her father to a regular scheduled medical appointment, and she had to be his advocate too. So we all need to be our own advocates for our best medical care and keep track of what's going on and make sure our needs are served. If we have a child or another family member that needs our help, we need to take a part in that too. Your doctor knows a lot about medicine and your medical care, but only you know about you. You know yourself best. There might be more than one option for you in your care, and your doctor would be able to share these with you. But you also need to share your beliefs, your values, and your lifestyle with your doctor so that he can make a good decision about what works well for you. Now, there's lots of reasons for seeing a doctor. You might have developed a new problem or a symptom. You might be going to a follow-up appointment for a symptom that you talked to the doctor about before. You might be seeing a new doctor, or your regular doctor sending you to a specialist. Or you could just have appointments for ongoing problems that need repetitive checkups. Or you could be taking a healthy child to the doctor or a wellness appointment of your own. The Center for Disease Control tells us that every year in this country, 1.1 billion visits are made to doctors' offices, emergency rooms, and outpatient clinics. The most frequent reason for going to the doctor's office is a general medical exam. And the most common problem that's found during one of these visits is hypertension. But whatever your needs or your reason for seeing a doctor, you need to prepare for your visit. One of the things that you can do to help your doctor is to take along a list of your prescriptions or over-the-counter drugs and herbs and vitamins that you might be taking, and a schedule of how often you take them. Once a day, 3 times a day, when you have a headache. Also, if you have a health care plan that has a prescription plan in it, you can take a formulary which tells which drugs are covered under your plan. The other thing you should take to your doctor's appointment and prepare ahead of time is a list of questions to ask the doctor. Recently, I found a great resource called Build Your Question List, and it's at the U.S. Department of Health and Human Services, their Agency for Healthcare Research. I've included this in a handout that I've made for the rest of you this evening that I'll give to you later. In it, you can build questions about asking about prescriptions or tests or a diagnosis the doctor might have made for you or treatment or surgery that he might be recommending. At your exam, when you're there, you need to build a relationship with your doctor and be an active participant in your appointment. Listen carefully to what the doctor says. And if you don't understand what he's telling you, ask questions. Then, if your doctor presents you with a treatment he thinks you should follow, tell him or her truthfully if you think that you can carry out this treatment, and if not, why you don't think you'll be able to. If you take a child or another family member to an appointment, prepare them in advance for tests and exams, what to expect, why they're going. Also, for a child, make sure that what you tell them is age appropriate and to their development level. Why should you partner with your doctor? Well, just a moment. I'm going to stop the tape and then I'll tell you in my second half.